Hello everyone, it's April 27th. I'm Dr. Adam London, Director of the Kent County Health Department. Yesterday, the state reported 37,778 cases of COVID-19, which is an increase of 575 over the previous day. The number of deaths statewide totaled 3,315, which is an increase of 41 over the previous day. So we're seeing some relatively flat numbers. We're actually seeing some pretty low numbers from the state. Although I want to caution you a little bit that over the weekend we tend to get lower numbers. We think that's because of staffing changes over the weekend, perhaps some batched results which don't get fully reported until early in the week. So we'll wait a day or two to see what those numbers look like after Monday and Tuesday. Here in Kent County, as of this morning, we're at 1,084 cases, which is an increase of 53 over yesterday's reported number. And our death total is now at 33, which is an increase of 1 over yesterday. And so here in the county, again, a smaller number than we've seen the previous few days, which is very encouraging. Although there is quite a bit of fluctuation in our Kent County number because the testing has increased, but also because we're doing some very targeted testing here at the health department. And when we have a big batch of samples that we're expecting, that tends to drive that number up because our testing is really focused in those areas where we have the most vulnerable populations. And we were not waiting for one of those batches this morning. So again, our number, 53 of an increase. So that tends to be consistent with this idea that overall we're seeing a flattening of the curve here in Kent County. The governor issued an executive order last week extending the stay-at-home order through May 15th. There was also some loosening of the restrictions in that order. We expect there may be some more loosening of restrictions going forward. I'm not sure exactly what's going to happen as the 15th approaches, how or if we're going to see any further extensions. But I do expect, and I do hope, that there are smart loosening of restrictions that we can phase into a reopening, a general reopening, at least of significant portions of the economy and society, so that we can get back to work and we can do it in a smart way that limits the risk of harm to anyone. We're also thinking about this in light of what it means to flatten the curve and what the purpose of flattening the curve was to begin with. You know, we've been talking about flattening the curve for well over a month now, keeping in mind that our purpose there was to really brace for impact and make sure that our hospitals could sustain any surge on the original arrival of COVID-19, the virus here in the community. Of course, our other and most important priority was preventing illness and saving lives. In doing that, so that we weren't overwhelming those hospitals, because when the hospitals get overwhelmed, that's when we have seen in other communities the mortality rates really increase. We've done that now. And so we're now looking at what's the next phase. And as the hospitals have prepared, and they've done a tremendous job in making sure they can care for a lot of people, we also have plans in place. The Army Corps of Engineers has been in town. They've looked at facilities as alternate care settings in case we had a huge surge in cases. Thankfully, we have not need to use those facilities or capacities. But now we're looking at how do we live in a world with COVID-19 from now until we have therapeutic drugs available and until we have vaccination available. And so we're getting lots of questions about when is life going to return to normal, and can we have concerts in the park and recreational sports this summer and parades and conferences and all these things that we want very badly to bring back. And the easy answer, unfortunately, is that I don't know. But we're going to be watching the data very carefully. We're also watching what comes out of the governor's office and the state and federal agencies that have some authority here as well. But I do know that as we look at that data, it's very important that we keep the case count below within the capacity of the hospitals to provide care. And I know that regardless of the dates or the requirements that may be in place, that we're going to be encouraging all of you to maintain that 6-foot separation whenever you're outside in a public space. We know that we're going to be wearing masks or some kind of cloth covering over the face for an extended period of time. And that just makes sense. It makes sense because that's how this virus is spread. And until we have a vaccine or therapeutic drugs, we need to do the simple things, at the very least, that can prevent the spread of this. We know that sick people are going to be expected to stay home, regardless of what the symptoms are. We know that people who can work from home should work from home as much as reasonably possible from now until we have pharmaceutical solutions available. And that vulnerable people, those who are 65 or older or have underlying health conditions, those people should be limiting their exposure to public gatherings and the virus as much as possible. And that we can't completely make our world 100% safe. We've heard a lot about safe or unsafe. And while safety is something that we should strive for, and 100% safe is something that's an ideal, the reality is that as long as the virus is here, there's going to be some risk. And so we all have to accept and recognize that our workplaces, our public gatherings are never going to be 100% safe from COVID-19. So we need to do the things that we can do, the things that we're empowered to do to reduce that risk as much as possible. So I look forward to working with you over the course of however many months this takes. We're all in this for the long haul. We're all in this together. We're in this to make sure that we all get through this. I don't want to see anyone suffer or get hurt unnecessarily so, and there are so many things that we can do to reduce the risk to others and to protect those, especially those who are most vulnerable. I'm Dr. Adam London, Director of the Kent County Health Department, encouraging you to stay positive, stay heroic, stay healthy, and I'll talk to you again tomorrow.